Welcome to EPG Pathshala on the subject Social Medicine and Community Health. I, Dr. C.P. Mishra, Professor in the Institute of Medical Sciences, Banaras Hindu University, and belonging to the Department of Community Medicine, I'll be discussing the module, first area on 12th 5-year plan, which belongs to the paper National Health Programs and Policies. This module has been developed by a team comprising of experts from different parts of the country. The learning objectives that has been set for this module is to know the outcome indicators of 12th 5-year plan and to describe the thrust areas in the plan with a special reference to universal health coverage and national health mission. Since the inception of the planning process in the country, 5-year plans has been evolved. And these plans served as the instrument for socio-economic development in the country. 5-year plans evolved to create desirable health indicators, and right now 12th 5 plan, which was started in the year 2012 and till 2017, aims at sustainable, achievable and universal coverage. 12th plans emphasizes on faster, sustainable and inclusive growth. Outcome indicators have been set and monitored. Now, this 12th 5-year plan has clearly identified that health cannot be delivered only by health department. There is strong need for inter-sectoral convergence and community participation. A number of indicators have been set to be achieved by the end of the 12th 5-year plan. The first indicator, infant mortality rate, which refers to number of infant deaths per 1,000 population. The target set is 25 per 1,000 live births by the year 2017. Maternal mortality rate has been set to 100 per 100,000 live births. Total fertility rate is targeted to be achieved by 2017 is 2.1. It means we'll be reaching to the replacement fertility when one girl child will replace another girl child. Undernutrition in children under 3 years, as we all know that during National Health and Family Survey 3rd, which was conducted around 2005, the undernutrition in children was quite high. And it is envisaged that by the end of 12th 5-year plan, we'll be able to reduce to half of the value figure during NFHS 3. Anemia among women, particularly the age group 15 to 49, is a significant problem. And 12th plan had been, while formulating 12th plan, it was envisaged that this level should be reduced to 28%. Adverse child sex ratio, particularly in the age group 0 to 6 years, is of very, very serious concern. It is envisaged in the program that this adverse child sex ratio, which is 940, should be increased to 950 per 1,000 male child by the year 2017. Reduction in the per household out-of-pocket expenditure is desired because in India, around 2% of the population every year goes below poverty line just because of meeting the expenditure of health care. So, and this high catastrophic out-of-pocket expenditure has to be reduced, and we have to increase the public health spending. Prevention and reduction of non-communicable diseases. In fact, India is facing double burden of disease. Communicable diseases are there, and on the other hand, significant proportion of non-communicable diseases are also coming up. So we have to increase measures to reduce this trend. Goals to be achieved for communicable diseases in the 12th plan period is, number one is tuberculosis. For tuberculosis, we have to reduce annual incidence and mortality by half. For leprosy, we have to reduce prevalence of leprosy to less than 1 per 10,000 population, and incidence to zero in all districts. Malaria annual incidence has to be reduced to less than 1 per 1,000. Filariasis, we had been committed to elimination of lymphatic filariasis by 2015. It is envisaged in the 12th plan that filaria problem should be less than 1% microfilaria prevalence in all the districts of the country. Dengue, sustaining case fatality rate to less than 1%. Chikungunya, containment of the outbreaks. Japanese encephalitis, reduction in the mortality by 30%. Kala-Azar, elimination by 2015 was the target, and that is less than 1 per 10,000. HIV, AIDS, reduce new infections and give care, support and treatment to persons living with HIV and AIDS. Outcome indicators for 12th 5-year plan has been envisaged. Infant mortality rate, which is a very sensitive indicator of provision of maternal and child health services, refers to number of infant deaths per 1,000 live births, and targeted that by the year 2017 we'll be able to achieve a target of 25 per 1,000 live births. At the time of independence, infant mortality rate in the country was quite high. It was more than 150 per 1,000 live births. Significant reduction had already taken place, and the figure has come around 40 per 1,000 live births. However, more concerted efforts are needed, particularly on the neonatal mortality rate, which has remained almost stationary in the last 10 decades, in the previous decades, so that we can accelerate reduction in infant mortality rate and we'll be able to achieve our target. Maternal mortality rate, which is quite high in the country, it is envisaged that we'll be able to achieve a target of 100 per 100,000 live births by the year 2017. A number of efforts have been initiated. Besides provision of effective antenatal care, maternal services have been extended. Janani Suraksha Yojana is there. A lot of inputs are being taken care in terms of operationalization of first referral units, so that causes of maternal mortality rate can be taken care of, particularly postpartum hemorrhage, antepartum hemorrhage, sepsis, shock, and obstructed labor, and so on. And anemia is a very significant contributor to maternal mortality rate in our country. And the current approach to control of that also needs revisiting. Total fertility rate is an important determinant of fertility in any country, and it was envisaged that we should be able to reduce total fertility rate to 2.1. Earlier it was targeted at 2010, but somehow at the national level we have been not able to achieve. Some smaller states have already achieved this, but unless we major states take care of, the total fertility cannot be achieved to that level. So we have to prioritize our actions so that total fertility rate reaches to 2.1 by the year 2017. Particularly, you have to put a lot of emphasis on spacing methods, and also raising the age of marriage so that this can take place. Undernutrition in children is a very, very serious and challenging problem. From NFHS 1, 2 and 3, the reduction has been very, very marginal. And therefore, while drafting 12th 5-year plan, it was thought that this problem must be resolved. And the target that had been set, that whatever values were there at the time of NFHS 3, that is the year 2005, half of that should be reduced by the 2017. Undernutrition, particularly based on stunting, wasting, and also underweight, all these three conditions are existing in our community, and that needs special attention by adopting different approaches. Anemia among women is quite high. Anemia is a condition that affects quality of life, that affects physical efficiency, that is cause of low performance, that leads to maternal mortality, perinatal mortality, low birth weight, and so on. So there are so many problems related to anemia, and even 1/5 of maternal deaths are also accounted by anemia, as I've said earlier. Therefore, anemia needs proper attention. The approaches, that is pharmacological supplementation, dietary diversification, and hookworm control, malaria control, needs more focused attention. What is important that the pre-pregnancy hemoglobin level in general population needs to be enhanced, and that can be achieved through dietary diversification. That means that encouraging consumption of foods rich in iron. In spite of several measures taken in the country, child sex ratio, particularly in the age group 0 to 6 years, is still quite low. That clearly tells us that there is a gender discrimination in the child care. It may, even in the pre-diagnostic tests that are being performed in the country, that may be contributing at the time of birth. But even after birth, there are factors that are leading to infant mortality, child mortality, or favoring death in female children. Reduction in the per household out-of-pocket expenditure. In the event of serious morbidities, the expenditure, particularly out-of-pocket expenditure, is quite high in our country. It is estimated that 2% of Indian population goes below poverty line every year because of catastrophic out-of-pocket expenditure. Therefore, it is envisaged during 12th plan, we should be able to increase the public health spending so that out-of-pocket expenditure will be reduced. Prevention and reduction of non-communicable diseases. We all know that non-communicable diseases, particularly diabetes, hypertension, and other conditions are on rise, cancer, and are on rise. In fact, India is facing double burden of disease. On the one hand, we are not able to take care of adequately of the communicable diseases. On the other hand, non-communicable diseases are on rise. There is another third dimension, that is behavioral problems, that has to be taken into account because behavioral problems are directly or indirectly involved for the occurrence of non-communicable disease. Even lifestyle modifications are also required. A number of communicable diseases like tuberculosis, leprosy, malaria, filariasis, dengue, chikungunya, Japanese encephalitis, kala-azar, HIV and AIDS are still a potential threat. Tuberculosis problem in the event of HIV and AIDS are posing serious challenges, particularly in terms of multi-drug resistant tuberculosis, extensive resistant tuberculosis. It is envisaged that tuberculosis needs a lot of prioritization, and it is envisaged by the end of the 12th 5-year plan, that is by the year 2017, we should be able to reduce annual incidence and mortality due to tuberculosis by half. This can be achieved because DOTS is a very proven strategy. Directly of short course therapy is a very well-tested methodology, and we have to also take care of MDR and XDR tuberculosis, for which institutional mechanisms have been evolved, and it is envisaged that by the year 2017 we will be able to achieve the goal of tuberculosis. Leprosy eradication program has been launched long back, and the target that has been set that we should be able to reduce prevalence of leprosy to less than 1 per 10,000 and incidence to 0 in all the districts of our country, so that global and national elimination can be achieved. Malaria has been a significant problem. A lot of efforts have been directed. If you go back to the 1953, there were 76 million cases per year in India. Right now, we have less than 2 million cases per year. But concerted efforts are needed because there are several paradigm shifts in malaria. desert malaria, tribal malaria, border malaria are on rise, and falciparum rise in malaria is increasing. These are putting a lot of problems, and particularly malaria-associated deaths. So malaria needs a lot of prioritization, and it is envisaged that annual malaria incidence as a whole for the country level will reduce to less than 1 per 1,000 population. Filariasis, for this disease, we have already committed for elimination of lymphatic filariasis in India by 2015. And for elimination, we have to achieve less than 1 microfilaria prevalence in all the districts. There are certain districts which have microfilaria prevalence more than 1%, and they are posing serious challenge. Mass drug administration and other control measures has to be instituted in a rigorous manner, particularly MDA, standard drug case management, vector control strategies, and community participation as a whole in this program may lead to us to less than 1% microfilaria prevalence in all districts by the year 2017. Dengue outbreaks and dengue-related problems. Everybody is aware that several outbreaks are taking place, and they are putting to also mortality component is being very alarming. And therefore, we have to take care of that. At least there should be no deaths due to dengue, and it is envisaged that the case fatality of dengue, by that we mean number of dengue cases, total number of cases, and also we take into cognizance total number of deaths due to dengue. So number of deaths due to dengue divided by total number of cases into 100, that will give us the case fatality rate due to dengue. Chikungunya outbreaks, earlier it was confined to South India, but now it is common in North India as well. The factors that may contribute to that is maybe coconut cells, broken bottles, tires, and so on. And there becomes the place of breeding, and that is the chikungunya is being transmitted through these vectors. So containment of outbreaks due to chikungunya needs environmental manipulation and other strategies, but that we have to take into account. Japanese encephalitis is confined to certain areas of the country, particularly eastern UP and other parts of the country, so where rice fields are there. And one must be taken to cognizance that JE is one component of acute flaccid paralysis. Japanese encephalitis and other acute encephalitic syndrome diseases are contributing significantly to the mortality, particularly in the younger age group. A number of measures have been initiated. However, it is targeted in the 12th 5-year plan that we must achieve a reduction in the mortality by JE by 30%. Acute encephalitic syndrome is a condition that is not only caused by JE, but there are other viruses, particularly gastrointestinal viruses, that are responsible for this. And a holistic approach are needed to control acute encephalitic syndrome and mortality associated with this. Service provisions are there, ventilators are provided, awareness is being created, and also vaccination programs for JE is invoked. Kala-Azar elimination was targeted by 2015, but the target that has been set by 2017 is less than 1 per 10,000 cases in the country as a whole, but Kala-Azar has a geographical distribution. There are certain special pockets in the country where Kala-Azar is invoked. HIV/AIDS, lot of inputs have gone in this deadly disease, which involves active and productive population of the country. It is envisaged by 2017 we'll be able to reduce new infections and we'll be able to provide care, support and treatment to persons living with HIV and AIDS, people living with HIV and AIDS. Universal Health Coverage Day is being observed every year on 12th December as a global initiative by the United Nations to ensure that every individual has access to health care without suffering financial hardships. It implies that everybody will be having to access to health care irrespective of their financial position, caste, creed, geographical location, and so on. As per World Health Organization, about 1 billion people don't have access to health. It implies that roughly 1/6 of the people in the globe don't have access to health. Please note that it is a global figure. There are certain areas where this figure is very high and there are certain areas where this figure is very low. Therefore, the average figures may not reflect the real situation that is happening. Urban health care aims to provide affordable, accountable health service of assured quality. As such, it includes promotion of combination of curative, preventive, promotive, and rehabilitative services, whatever we call it as comprehensive health care from home to tomb. 12th five-year plan has inclusive agenda for health. It emphasizes on monitoring and evaluation. Because monitoring and evaluation refers to a degree of achievement against predetermined objective. There is no point that evaluating a particular program at the end of the plan and then saying that we are not on the right path. In midterm, evaluations will be also necessary so that midterm corrections can be imposed. Representation in the community forum with women having 50% representations. Training of health and rehabilitation professionals, capacity building, where capacity building is important. Special services for poor, weak, and disadvantaged population. Inclusive growth, inclusive healthcare, inclusive is the agenda in the 12th five-year plan. Achieving universal health coverage through a model. As we have discussed that universal health coverage has taken as the instrument for improving health of the country. And universal health coverage involves a lot of financial commitments and strategic planning. Through essential health package, clinical services needs to be provided and financed by the government. So essential health entitlements issues will also be taken into account in provision of universal health coverage, because it is not possible to provide care for each and every element, but a minimum set of entitlements and different levels of care has to be involved in this provision of universal health coverage. Main domains as per high-level expert group committee. Planning Commission in 2010 constituted a high-level expert group, and they have identified certain main domains. The first and foremost domain is health financing and financial protection. By health financing, we mean that greater commitment on the public sector, particularly by the public sector on health. Say, for example, Sri Lanka and Bangladesh, they spend much more than what we are spending for health, and they have better health indicators. So it is envisaged that the proportion of GDP on health financing will be enhanced from 1.03 to 2.5%. And by the term financial protection, we mean that nobody will be facing hardships just because of a disease condition. Financial protection is needed because nobody should be going to below poverty line or facing hardships just because of disease conditions. Access to medicines, vaccines, and technology is another domain that needs consideration. Particularly when we are talking of medicines, we are referring to essential medical medicines. And lists are available at different levels of care which are considered as essential medicine. Vital, desirable, and essential medicines. That list has been made by WHO and other organizations for different levels. Human resource for health is also important, because unless there are manpower or unless there are human resource, no services can be delivered. However, it is also the truth that only persons placed in a particular system we may not give the desired outcomes unless there is other supports and unless there is a system of monitoring and evaluating that how they are working. Health service norms have been defined by various organizations. Then management and institutional reforms. There is a need for managerial and institutional reforms. Because within the system or within in a state or we are observing that in some states, in some districts, performance is much better than the other districts. The same vaccines, same drugs, same workforce, but it is the quality of leadership, the managerial reforms, and institutional capacity building that is making a difference. Community participation and citizen engagements in health sector, particularly by establishing participatory councils, is desired. Community participation can take place at various levels in health sector. One is in the planning stage, second in the delivery of services, third is in the utilization of services, and fourth and the evolution of health services. If people start dreaming provision of health services as their rights, probably there will be more citizen consciousness and more demands for this. Gender streamlining and gender-sensitive health provision of gender-sensitive health care is important. The core principles of National Health Mission are universal coverage. That means that nobody will be denied of health care because of any other criteria, maybe geographical, caste, creed, or financial level. Continuum of care. It means that from inception to last breath, continuum care has to be extended. Particularly in the areas of reproductive health, we are taking care of this, but continuum care is desired because other genetic problems have that. Decentralized planning. This is very, very vital because there are geographical, India is a very big country, there are many Indias within India, and one place varies from other place. In the year 2005, we started National Rural Health Mission, and this had important components in terms of reproductive and child health, National Disease Control Program, Total Sanity Campaign. But during start of 12th 5-year plan, it was realized that let us move from National Rural Health Mission to National Health Mission. And the core principles of National Health Mission had been universal coverage. That implies that nobody will be denied a provision of essential health care just on basis of any other criteria. Maybe caste, maybe creed, maybe financial status, and so on. Then, another core principle had been continuum of care, that comprehensive health care, that is preventive, promotive, curative, and rehabilitative care should be provided from each stage of life, right from inception at the end of life, that is till death or even beyond that. Then, decentralized planning. Why decentralized planning? Because India is a huge country. It varies from place to place, from state to state, region to region, and each country, each part of the country has different problems. So decentralized planning is needed. Then achieving quality standards, because satisfied client is the best motivator. So you have to emphasize upon the quality of care. It was clearly emphasized that certain areas, particularly urban slums, are poorer than even rural areas. And we don't have any organized care for urban areas, particularly community-based care. So, at the beginning of the 12th plan, it was emphasized that let us start health services for urban areas. A National Urban Health Mission, which is a part of National Health Mission, has been emphasized upon and the Union Cabinet launched with the following proposals. One urban primary health center, that will be known as UPSC, for every 50 to 60,000 population. One ASA community link worker for 200 to 500 households in urban area, and one urban community health center for every 5 to 6 urban primary health centers in the big cities, and one auxiliary nurse midwife ANM for 10,000 population. In order to provide financial protection, although Rashtriya Swasthya Bima Yojana was existing, but it was said that it has to be scaled up. The unique features will be empowering beneficiary, equal role of stakeholders in hospitals, and eligibility was people working in organized sectors, workers belonging to BPL, and provision was extended to maximum of family of 5 members. This is a injustice because persons who are living below poverty line, they become victim in the event of any health catastrophe, and about 2% of the people below poverty line, as I've said earlier, goes below poverty line just because of health problems. And now this program that is launched by Ministry of Labour, Government of India. The provisions provided in this package, that is by Rashtriya Swasthya Bima Yojana, hospitalization expenses up to 30,000, over 725 predefined surgical packages are there, maternity and newborn care package is there, daycare services are there, and cover all pre-existing diseases. 1 day prior hospitalization and 5 days after hospitalization expenses are taken care of. And also there is a provision for transport, ₹100 per visit, with overall limit of 1,000 per year. Although Rashtriya Bima Swasthya Yojana provisions are very important, there are certain conditions that have been not considered in the package. Conditions not requiring hospitalization, congenital external disease, drugs and alcohol-induced diseases, sterilization and fertility issue, vaccination, war and nuclear invasions. Other major thrust areas are health financing. It implies that government sector will put more funds for health sector. It must be increased in a phased manner, because health financing is a very critical input. Without sufficient budget, probably health services, standard quality health services may not be delivered. Regulation of health and medical standards through accreditation, because when private and public-private sectors are being involved in the health provision of healthcare, then question of regulation of health sector, particularly in both the sectors, public and private, becomes of paramount importance. National level healthcare institutions have to be involved, like AIMS and other training institutions, and national bodies have to be involved. National health workforce has to be created, and for that purpose, National Health Regulatory and Development Authority, National Drug Regulatory and Development Authority, and National Health Protection and Promotion and Protection Trust are being involved. Information technology in health, e-health governance issues are becoming important, particularly for tracking of services, for provision of services, in provision of reproductive and child health services, other services. E-health governance, financial governance and other issues are very, very vital. Next is, would like to confine to health research and convergence across all sectors. Government of India is very clear that there are newer emerging conditions, and even the health budget available for health research has been enhanced in the country. Also, there is a prioritization from those models which are very indicative of performance that must be tried in the research mode. Other major thrust areas are National AIDS Control Program has received a lot of attention in the past. given due priority because of two distinct reasons. One, it affects the young and productive population of the country. Second, the linkages of AIDS with tuberculosis. So this program, particularly at ART Center, provision of antiretroviral drugs along with linking with the anti-tubercular drugs is important. Nutrition promotion needs special attention because in spite of so many inputs, the overall figures of undernutrition, anemia, and other problems are not declining to that extent. On the one hand, on the other hand, obesity, overweight, particularly in female adult population and also in adults, are becoming a very serious problem. And in emergence of non-communicable diseases, lifestyle diseases are creating a lot of problems. So nutrition promotion needs special attention in all segments of the population. In fact, ICDS is taking care of 0 to 6 year children, to some extent adolescents and reproductive population. But nutrition care is required at all levels of life, all phases of life. Drinking water and sanitation, that has to, our present government is putting a lot of emphasis, even in the National Rural Mission Total Sanitary Campaign, that has been committed to the Bharat Nirmal Yojana. So a lot of emphasis has to be given that, so that waterborne diseases or diseases related to sanitation, improper sanitation should be taken care of. So Total Sanitary Campaign, as it was envisaged in the National Rural Mission as an important mission, it is also emphasized in the 12th plan also that this should be, enough emphasis should be given on this aspect of care. The mainstreaming quality standards and ethical issues in 12th plan has to be achieved for the progress of the nation. Ethical issues are becoming important because there are many issues that are coming in front. One important issue is that mainstreaming IU's system of medicine, holistic provision of integrating different systems of medicine in the provision of universal health coverage is also desired. Just to summarize that what we have discussed today, that since independence, Government of India has given a lot of emphasis on socio-economic development, and 5-year plans has been considered as an instrument for socio-economic development, in which health was considered as a major input. These improvements from plan to plan has been based on recommendations of various committees, right from Board Committee to Jangalwala Committee to Srivastav Committee and so on. And country has progressed on the front of health. Many diseases have been eradicated. Many health problems have been brought to substantially low level, but newer areas have emerged like non-communicable diseases. Newer diseases are emerging. And in fact, India is facing triple burden of disease right now. Non-communicable diseases, communicable diseases are already existing, and another dimension is behavioral diseases, that is mental problems that are also emerging. So if you are contemplating for provision of universal health care, which has been taken as a major instrument in the 12th 5-year plan, a lot of budgetary provisions are required. Even it is very difficult to provide services for all diseases, but minimal entitlements or essential entitlements at different level of care has to be identified. It is also emphasized that health sector can give only medical care. If you want to raise the health standards of the people of India, then other sectors must join it, and like environment, water supply, and so on, ICDS and so on, Ministry of so that a convergence mode we can get optimum dividends. It is also emphasized in the 12th plan that we have to take into cognizance that Government is keen to start National Health Mission. Government wanted to move from National Rural Health Mission to National Urban Health Mission. This has been done realizing the fact that in many pockets of urban areas are much inferior, worse than rural areas, and in those areas we don't have community-based organized care. And therefore, Urban Health Mission has been launched, and urban primary health centers will be in vogue, and they will give better dividends in near future. By the end of 2017, it may just possible that maybe some targets will be not achieved, as it has happened in the past. But certainly, every plan, including 12th five-year plan, gives a roadmap to progress and gives a set of indicators against which we can gauge where we are moving forward. Thank you very much for visiting EPG Patsan.